than the STD we talked about previously, we can have 4 other issues. At least 4 other issues. Okay, erectile dysfunction is the medical name. The general name is the impotence. Inability to produce or maintain an erection. Okay. It can be diseases, medication, alcohol consumption. Yes, alcohol consumption, psychological factor. Psychological factor is the one that I mentioned, stress or depression. Alcohol consumption, yes. And also, believe it or not, some recreation drug, for example, the famous one is the ecstasy. Ecstasy can also cause impotence. Many young people do not know that. They think that, oh, taking ecstasy when you are high and then let's go and have sex, that'll be great. Actually, it's not. The reason ecstasy can cause impotence is that ecstasy secrete a large dosage of adrenaline, epinephrine and norepinephrine secretion in your body, so that you will increase your heart rate, increase your activity, make you very high. You sweat a lot. That's the issue. When you sweat a lot and lose a lot of sweat, water in your body, then your body do not have enough water to cause the erection. And other than the epinephrine, also the ecstasy also causes a large amount of dopamine secreted in your brain that makes you high. And then drugs that increase blood flow to the penis are the common treatment. So the drug that it refers to is, of course, the Viagra. Okay, remember I talked about benign prostatic hyperplasia, BPH. This is the prostate enlargement. Benign prostatic hyperplasia. In this case, it is very common to cause urethral constriction. So that the patient cannot urinate. In this case, they have to go to the emergency room so that the nurse will insert something called a catheter. Catheter is basically just a plastic tube. Of course, before they insert it, they will put the tube into Vaseline to lubricate it, and then they will insert it. Yes, usually without anesthesia. Insert it from the tip of the penis, yes, with the Vaseline on the tube, on the catheter, and then insert it all the way into the bladder, because the enlargement of prostate will will constrict the urethra, so that they have to insert this catheter directly into the bladder, so that in order to let go of the urine. It is extremely painful, but at least it saved the patient's life. And treatment is medication and or surgery. Mainly the major treatment is surgery. Actually, the doctor will now when people do surgery, of course they will receive local anesthesia. Doctor will insert a wire loop, also again from the tip of the penis all the way to the prostate gland, and then the wire loop is connected to a motor, so that when the motor starts, then the wire loop will rotate, and then you will physically destroy the prostate gland. When the prostate gland is destroyed, then it does not press against the bladder, and also it does not constrict the urethra. Then problem solved. And as you know that making semen uses 3 glands. So one of the 3 glands is gone. You still have two glands, the seminal vesicles and bulbourethral glands. So that should be fine. Okay. Medication, yes, medication can control or slow down the enlargement, but it's not as good. It's not as good as the surgical treatment. Other than the wire loop or physically destroying the prostate gland, doctor can also use a frozen probe to freeze the prostate gland. When the prostate gland is frozen, then it will shrink. And cancer, prostate cancer, it is a common cancer in American males. It is treatable if detected early. As I said, that if a BPH, benign prostatic hyperplasia, is not treated, the patient will have a high risk to develop into prostate cancer. So let's take a look at the relative position. You can see that the prostate gland is here, and the urinary bladder is here. So the prostate gland is right under the urinary bladder. When the prostate gland enlarges, what will happen? It will press from bottom up against the urinary bladder. So normally when your urinary bladder is filled with urine, then the urinary bladder will stretch, and there are stretch receptors in the urinary bladder. They will send a signal to the brain, telling your brain that, okay, the urinary bladder is full, so let's go to have number one. Then that's the normal situation. But when a man has an enlarged prostate, the enlarged prostate will press against the urinary bladder from bottom up, so it will also stimulate the stretch receptor in the urinary bladder, so that the stretch receptor will send signal to the brain, telling the brain that, okay, you should go to have number one even before the urinary bladder is full. In other words, the first symptom of benign prostatic hyperplasia is that the man will have frequent urination. They'll go to have number one very often. But the issue is that every time they go to have number one, it will just be a little bit. It will just a little bit coming out. And then if they do not go to see a doctor, and then the second one is that they will have a narrow urethra. The urethra will be narrow, so a lot of old people, when they go to have urination, they usually stand in front of the urinal for a long time, because the urethra is narrowed and it have difficulty to pee. The worst case is what I told you in the last slide. The urethra is actually closed, constrict too much, it is actually closed, so that the man cannot urinate, and the accumulation of urine will cause the backflow of the urine going back through the urethra and then go all the way back to kidney. That will cause kidney damage. That is not good. So before that happen, usually the man should be admitted to the emergency room. Another signs of this benign prostatic hyperplasia is there blood coming out from the urine. Yeah, the urine will turn red because the enlargement of the prostate is so big that it damages the surrounding blood vessels, capillaries, and it causes blood seeping into the urine. So if you have any of these symptoms, blood in the urine, frequent urination, or difficulty to have urine, you must go to see a doctor immediately. Testicular cancer. Well, testicular cancer is one of the few cancers that occur among young people, okay? 15 to 35, 1 out of 200, so it is quite high prevalency. It is highly treatable if detected early. This is a common point for all types of cancer. Almost all types of cancer, they are like that. Of course, surgery, chemotherapy, or radiation, the usual three method of treating all kinds of cancer. The usual three treatment. Okay. Self-examination is highly recommended. Again, there's not much symptom that people tell. Self-examination is that you may want to see if there's any abnormal patches or abnormal hardness. Hardness is the important. If you have any bump or hardness in the testicle, if you notice that you have some abnormal bump or hardness in the testicle, then you should go to see doctor. Endometriosis. Okay, this is female. Female, it is not necessarily STD, but disorder of the reproductive system. So what it means is, okay, what is endometrial tissue? Endometrial tissue, endometrium, okay, endometrium is the innermost lining of the uterus. It is the part of the uterus that is in contact with the baby. So endometrial tissue outside the uterine cavity. So you have some inner lining of the uterus that are growing in other part of the female reproductive system. And when this happens, it will cause pain, abnormal menstrual cycle, or maybe even infertility. And the pain usually is not a regular menstrual cramp. Approximately, it is also occurring in young women a lot, and 10 to 33%. Include pain management, drug, and surgery. Surgery is like relatively good treatment because it is the endometrium growing in other part. Then you just surgically remove the endometrium from other part of the reproductive system. Ovarian cancer. Okay, this one is usually middle-aged women. They will start to have it, and they have 50%. They have 5-year survival rate. It is killing women really high. It is a high risk cancer. It is silent. Basically, it is difficult to detect. I mean, there's no obvious sign or symptoms until the cancer is a later stage. That's why only 50% of the 5-year survival rate. So when women know that, it is already too late. Again, the same 3 treatment for all kinds of surgery, all kind of tumor. Surgery, chemotherapy, and radiation. These are the 3 staple treatment for tumor. All kinds of cancer, all kinds of tumor. So women have never had children, they will have a higher risk. And actually, I want to put one more: smoking. As a matter of fact, okay, it sounds very obvious to many of you. Smoking actually increases the cancer rate for all kinds of cancer, for all kinds of people. Men, women, young or old, all kinds of cancer. Smoking is like, ultimate cancer inducer. It causes all kinds of cancer. Yes, it's not just lung cancer. It includes all of ovarian cancer, breast cancer, cervical cancer. As long as you can think about the cancer, then smoking increases the occurrence rate. Regarding to this point, no children. Yeah, women have no children, they will have a higher risk of ovarian cancer, and they will also have a higher risk of breast cancer as well. So having baby and nursing baby really changes the physiology, or I would say improving the physiology of women, so that women will lower the risk of all kinds of cancer by having children and nursing the baby. Okay, menstruation.